FUT hair transplant has left bald spots below the incision. What can I do? After my third hair transplant, but my first FUT procedure, I've been left with bald spots below the strip on both sides of my head. One of them is almost the size of my thumb. What can I do about this? Do I have to have another procedure just to fill them in, or is there a trick to get the hair to grow back?
Thank you for your question. You submitted your question with 2 photos, and you describe in the details of your question that this is your third hair transplant, however, it's your first FUT, and you're concerned about these bald spots in the donor area about the size of your thumb. And you're asking, is there a way to help this area either by transplanting more hair, or is there a trick to grow the hairs back? Well, I can certainly share with you my perspective on a situation like yours. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed that was derived out of our experience with hair transplant. And we are able to help patients from around the world, both men and women, non-surgically address hair thinning with technology that is now has become a category of regenerative medicine technology. So I can certainly share with you perspectives that can give you an understanding of what you're dealing with in those, quote, bald areas. So just to go back to what we were trying to achieve with with hair transplant, and that ultimately led to hair regeneration, doing what was mostly FUTs or strip surgery, the concern was always about getting a good donor area healing and to try to minimize the widening of the scar and to expedite the healing and to maximize the hair regrowth. And further, we also wanted our grafts to heal better. Well, I can tell you that using acellular matrix and platelet-rich plasma, we were able to achieve better healing of the donor area. Now, of course, in a situation like yours, where you've had 2 prior transplants, which were most likely FUE transplants or follicular unit extraction transplants, basically your graft had to be harvested very far and wide in the donor area. And then when you went ahead and got a second FUE transplant, those dots became closer together, which means the density was diminished. Now I could understand the strategic thinking, which makes a lot of sense, that if you have an additional surgery, that instead of trying to do another FUE, that you got an FUT or a strip surgery, because frankly the amount of density was being essentially limited. And so when you are, quote, looking for a question or asking a question about growing the hair back, there actually is unlikely to be any hair to grow back because the hairs have been transplanted. When you do surgery, hair transplant surgery, you're taking the whole follicular unit, the hair follicle with its adjoining oil glands and sweat glands and fat and everything else that goes with the hair. It's really, in a lot of ways, I always describe it as it's a skin graft with hair. And so you're moving the whole hair unit. So the hair cannot really grow back in that area. A lot of times when we see our patients who are not coming in for primarily hair regeneration, and this means both men and women whose hair is thinning, we see patients who also come from around the world who have had hair transplant. What they've learned, and from our experience, is we've been able to actually expedite the healing process of the hair transplant so that the grafts actually grow better and grow sooner. Now this is of course empiric data and is certainly vulnerable to criticism, But from experience doing transplants for so many years and then seeing how people's transplants do with our treatment, I think our data certainly has a lot of validity in helping our patients heal better. Now, sometimes the patients also ask us to do the injection into their donor area, and since they're coming from all over the world, we don't get to necessarily follow up with them. But I think that still it is, once a hair is gone, the hair is gone. And so I think that what you are going to have to try to figure out, and you can certainly work with your doctor on this, is that for that area to improve coverage, it is my opinion that if you're going to transplant hair, well, where exactly are you going to transplant from, and how much hair can you really transplant? And if you were to transplant that hair, would you not prefer to have that transplanted to an area that's more visible, which is in the front? That being said, I have discussed with my patients the opportunity to maybe consider doing some scalp micropigmentation, and although it's not a perfect solution, it might give you some assistance in camouflaging. A lot of times just strategic hairstyling can help, but it is a trade-off, and it is unfortunately the reality of doing as much transplantation as one can. And so I also advocate for even patients who have gotten several transplants. I advocate strongly something to be proactive to slow down the progression of their hair thinning. Now, of course, I don't see the top of your head, so I don't know what degree of hair loss you have. But I would say when we do our evaluations, we look at our patients who have transplants, and we look with a microscope, and very often not only do we see transplanted hairs, but we see miniaturized native hairs. So then we employ a treatment plan, and we employ hair regeneration technology. This is a combination of acellular matrix and platelet-rich plasma, and we'll actually be able to stimulate the area so that we can maximize more or further enhance the coverage. Hair regeneration is able to reactivate hairs that aren't currently growing, and that's the nature of hair thinning, is that a certain larger percentage of hairs enter a resting stage, and that resting stage is prolonged. We're able to thicken thinning hairs and prolong the longevity of the hair growth cycle. I've also observed that even transplanted hairs can actually have an improvement in their quality, and I think it's consistent with the reality that multiple transplantations creates a lot of scarring. And since we're dealing with regenerative medical technology, it stands to reason that the environment of where the transplanted hairs are in, where there's scar tissue and vascular compromise, that there is an improvement resulting in improvement in the transplanted hair as well. So I think that for your specific question about the back, there are very few options, and certainly you've been so committed to your management that you should certainly explore those. But I would also ask you to consider strongly a strategy to help maximize the longevity of scalp coverage with whatever tools are currently available. I explain to all of our patients, regardless of the number of transplants you do, hair loss is progressive. And the goal is to maximize coverage and maintain a certain look for as long as possible. So learn about your options in the world of pharmaceutical and regenerative technology, and see what you can do about the other options I discussed for the camouflaging of the donor area. So I hope that was helpful. I wish you the best of luck. Thank you for your question.